Dr. Ioana to understand the aesthetics of the lips and the concept of beauty.
Session of what is lip beauty. So I'm going to talk about ideal lips proportion throughout the history mainly, and some proportions, and then leave the injection techniques to get the perfect lips shape to my colleague Dr. Jamil. So what is lip beauty? So the beauty standards can seem amazingly solid. High cheekbones, big eyes, big lips. Thank you. But reality is that they are incredibly culturally influenced. So the ideal lips throughout the history differ from today's big-lipped Angelina Jolie and Kim Kardashian. So if we take a quick look throughout the history, let's see which are your ideal lips shape. So in the ancient Egypt, it wasn't such a big deal with big lips. The pyramids and the scrolls showed that symmetry was important, but mouth definitely took a side role. In the ancient Greece, it was all about the symmetry. The Greeks were big fans of the Cupid's bow, as you see in the picture, gently upturned corners of the mouth, and square bottoms. But proportion was the rule. The perfect Greek face, if divided in two, should look the same. If we go further in time, in the ancient India, so a good way to establish any culture, ideal beauty, is to look at their female gods, especially the ones devoted to romance and love. So Parvati, as you see in the picture, is the Hindi goddess of romance, and her 10th reincarnation here has a small but luscious rosebud lip. Further in time, the Chinese women of the Ming dynasty were expected to have pinpricked sized mouth, so the illusion of a small mouth could easily be painted over a larger one using elaborated makeup. This goddess in the picture is named Tara. He's a huge, important figure in the Buddhism. Her face emphasized a small but rounded mouth with accentuated curves and an upturned smile. Further in time, in Italy, the name of the painter, ironically considering, is Filippo Lippi. So the women of this period didn't emphasize the lips in any way. In Germany, as you see, the portrait of Venus demonstrates a small shift in the ideal picture of lips. The philtrum is deeper and more prominent. And the Dutch picture of Venus accentuates the line in the center of the lip with a brief point right in the middle. So in France, while the focus remains on the lip and silhouette of the lips, they are becoming more fuller and pinker, as you can see in this picture. The Gibson girl is pretty modern looking with big lips, big Cupid's bow, and accentuated volume that wouldn't look out of place in a Maybelline commercial. In America, the lips were incredibly defined and are realistic, huge Cupid's bow, pointed edges, and a small lower lip. Further in time, a more symmetrical mouth that was broader and more defined, the period where bottom lip became the queen. In the 80s, smiles were all about the teeth, not so massive lips. Everyone knows who this person is the Bollywood actress who was declared the most beautiful woman on earth, and the large part was due to her lips, but without having a single procedure. So nowadays, it's all about intense of the fullness of the lips. How long is this LDL gonna last? Only time can tell. So the certain features of the lips, probably as many as you know, we have 3 tubercles in the upper lip, 2 lateral and 1 in the middle. Then we have the cupid's bow right in the central of the lip, on the upper lip. Above the cupid bow, we have 2 philtral columns. So the philtrum is very interesting part of the lips. These 3 parts, during the embryonic phase, it comes together. When there is a failure in this process, we get the cleft lip. At the corners of the mouth, on the lateral side, continues the bottom lip. As you can see in this picture, usually the bottom lip is larger than the upper lip. Why is that? Because, as Sebastian said, we have the mentalis muscle, which is pulled upward during the closing of the mouth. The orbicularis oris muscle crosses horizontally under the lips, which helps us to close our mouth. So the lateral aspect of the lips becomes obliterated in time as this orbicularis oris muscle becomes stronger. The mouth proportions. If we consider 2 imaginary lines between the corners of the mouth and the medial border of the iris, it should be in perfect proportions. Another way to calculate is half the length between the lateral canthus of the both eyes. The distance between the border of the upper lip to the subnasium should be half of the length from the ala to the tip of the nose. The H angle. If you consider another imaginary line from the nasium to the Pogonian, and another one from the Pogonian to the columella or subnasium, and the angle between these 2 lines should always be 10 degrees. The Ricketts line is the most easy to use in your clinic by taking a marking pen and putting it between the Pogonian, the chin, and the nose to see how much to correct the lips. Sometimes you need to take into consideration if the patient has a smaller nose or a bigger nose, respectively the chin. So in an ideal proportion, the superior lip should be between 2 to 3 millimeters behind this line, and the lower lip should be 1 to 2 millimeters behind this line. Another way of measuring is as well imagining a line between the Pogonian and subnasium. The upper lip should be above this line or in front of this line 3.5 millimeters, and the lower lip should be 2.2 millimeters. The height, the vertical heights. If you take into consideration the lower third of the face and you measure between the subnasium and the menton, the upper third is measured till the middle of the lips, where the lips come together. It should be 1/3 compared to the middle of the lips down to the menton. The upper lip should be in proportion to the lower lip at the ratio of 1 to 1.6. And the distance between the subnasium and the meeting point of the lips and the vermilion border of the upper lip, should be 18 to 20 millimeters. When injecting, be careful. You will always get patients in your office asking for bigger, fuller lips. We cannot always inject the lips in that way. It will look natural. Do not overcorrect with more than 30 to 40%, and this is just a general rule. You should always reflect and evaluate your patient by the age, nasolabial lines, which can look deeper if you augment the lips too much. Inspect as well the dental arcades. If the patient are missing teeth at the lateral portions, it can make the lips look smaller at lateral sides. And what does the patient need? More definition, more volume, minimize the perioral wrinkles, relax the orbicularis oris muscle because of the gummy smiles, or elevate the corners of the mouth because of the DAO, or maybe she or he is a candidate for a lip surgery. Thank you so much.